The Trump administration has a new proposal to lower drug prices. They want to offer discounts directly to patients. The man behind the proposal is Alex Azar, Secretary of Health and Human Services, and he joins us now. Mr. Secretary, just explain it. How does this thing work?
Well, Stuart, you know, I like to give you exclusives, so I'm going to let you in on a little secret. When you show up at the pharmacy to pay for a drug that you need, there's somebody in the background called a pharmacy benefit manager, a middleman, and they're getting a kickback from the drug company on the drug you're buying. If your drug's price is $300, that kickback might be $60, $80, or $100. And today, that kickback does not help reduce the amount you're paying at the pharmacy. You're paying that $300, or you're paying a percent of that $300 often. Defenders of the status quo want to keep these discounts from seniors, but President Trump, with this proposal, is saying those kickbacks that are going to pharmacy benefit managers, these middlemen, now need to go to the patient when you show up at the pharmacy.
Okay. Now, Speaker Pelosi vigorously opposes this, and she's made a formal statement about it, and here it is. Here's what she said. The rebate proposal puts the majority of Medicare beneficiaries at risk of higher premiums and total out-of-pocket costs and puts the American taxpayer on the hook for hundreds of billions of dollars. She goes on. Under the proposal, the Trump administration's proposal, Big Pharma could see even bigger profits and even less restraint on what they charge seniors. Pretty strong stuff, Mr. Secretary. Your response?
Well, I look forward to working on a bipartisan basis to bring these types of savings to seniors when they hit the pharmacy. You know, we cannot defend the status quo. This is a catastrophically broken system. It's a system that encourages list prices to go up so that kickbacks can be paid to middlemen and not passed through to the senior citizen when they go into the pharmacy. And that's what the president's plan is going to do. It's going to take close to $30 billion in annual kickbacks that are going to middlemen right now and instead route them directly to the pharmacy when the senior citizen walks into the pharmacy counter. You know, if you're getting a drug that costs $300, and you're being asked to pay $100 out of pocket, that is incredible savings to you in January. And yes, if your premium goes up somewhat during the year, that's a bit of an offset. But we've calculated that for almost any senior who is taking drugs, and almost all of them do, you're going to come out way ahead under the president's plan here. You're going to save real money at the pain point of the pharmacy.
Now, is there to be a new law or a new rule of some sort that says, hey, no more middleman? The middleman is out. The benefit goes straight to the patient. Is it a rule or a law?
So it's a rule that has the effect of the law. So it's a proposal that we'll seek comment on, and eventually it'll become a regulation. And what it says is you can't pay these kickbacks to pharmacy benefit managers anymore. They've got to go directly to the patient when they go into the pharmacy. Now, those PBMs still play a very important role. They negotiate against pharma. They get those discounts. This is just about where that money goes, not about how much those discounts are.
When do you think we might actually see this rule imposed?
So we are proposing that this would take effect January 1st, 2020, which is when most Americans all of a sudden get hit with their full deductible as their plans reset at the calendar year. So it's real savings in America's seniors' pocketbooks within a year. January 1st, this could be coming to you.
Mr. Secretary, I just need to switch subjects for a second. We got this study in the New England Journal of Medicine which says those e-cigarettes are twice as effective as other nicotine replacements for getting smokers to kick the habit. That sounds like good news, but I think the FDA is cracking down on these e-cigs. Can you explain what's happening here?
Well, Stuart, we've been very clear that e-cigarettes can serve an important public health purpose, helping adults who are addicted to combustible tobacco have an off-ramp from that tobacco. It's better to be on an e-cigarette than it is to be on combustible tobacco. What we've said, though, is we are not going to allow the nation's youth to become addicted to nicotine through these e-cigarette devices.
Does that mean no flavors and absolutely no sales to anybody under 18?
So absolutely no sales to anyone under 18. And what we're doing on the flavors is ensuring that flavors are restricted to channels where they won't be able to get to children. It's about access and appealability. And so we want to make sure that those flavors are not in any setting where a kid could get them.
I could still be addicted to nicotine, though, with these e-cigarettes because I'm getting nicotine into my system. I can still get the addiction, right?
That's right, and it'd be better to have nothing in your system, but it's better to be on the e-cigarette satisfying the nicotine addiction and craving than it is to be actually smoking the tobacco product with all of the additional carcinogens that would be coming into your body.
Senator Kamala Harris, presidential hopeful, she wants Medicare for all. You keep hearing this expression. You're the Secretary of Health and Human Services. What do you make of Medicare for all?
So addressing the issue generally, not that one particular individual's comments, let me say Medicare for all is Medicare for none. What it really is about is undermining our promise to our seniors through the Medicare program that it'll be there for them when they need it. And it's also about taking insurance away from the 140 million plus Americans who have private insurance through their employers. You know, when these folks sold you on Obamacare, they made the promise that you could keep your insurance if you like it. They're not even promising that this time.
They didn't sell me on that, but that's another story entirely. Mr. Secretary, will you please come back during the course of this year, because we'd love to check up on the progress towards getting the drug prices down for actual patients. Mr. Secretary, thanks for being with us today, sir.
Thank you.
See you soon.